Don't you feel like a hypocrite sometimes when you
Yes.
tell your patient, like, oh my God, junk food is so bad for your health. You're like lessening the years of your lives from eating this shitty junk food from McDonald's and stuff. And then my Uber dings. Because security is like, are you ready to pick up your 2 cheeseburger and your poutine? And like, yep, I'm ready. I'm picking it up right now. Hello, my favorite caffeinated, medicated, and never hydrated Bessie. It's your favorite nurse, Nurse John, and welcome back to your favorite podcast. I beg your pardon. How are you doing? I hope you're doing well. I hope life is great. Bessie, I miss you. Did you miss me? I know you did. I just assume because you're here listening to me. So yes, you missed me. It's another week of therapy. Cause who doesn't need therapy? We're all a little bit mentally ill, and we need that. We need that. Well, Bessie, I just want to let you know that life is going great here for me. And I just am so thankful that I can wake up every single day and make new memories and start again and keep doing it. Just like how I tell you every single time that if life is not going the way you want it, Bessie, there's always another day. There's always another chance to make it as long as you don't give up on yourself. Your worst enemy is yourself. Not anyone else's opinion, not anyone else, but you. So every single time you wake up, you gotta praise yourself. You gotta be kind to yourself. You gotta love yourself. And that's the only way you can be confident. You can look forward for new beginnings, new chapters in your life, and keep going. Anyways, Bessie, if you're listening to this right now, do me a quick favor. Make sure that you download this new episode and all the other episodes that you haven't listened to, Bessie, because this is a weekly therapy. And for you to be able to recover from that trauma and burnout and everything else that's happening, you gotta listen to every single episode. Follow us and turn on notification on Spotify and Apple Podcasts. And Bessie, if you also don't know, we gotta stay caffeinated, right? I just had my 2 coffee this morning, and guess what? I'm mixing it with energy drink because why not? Because coffee is not working anymore. I don't know why. I think yeah, my guess is just laughing because I'm just crazy. But yeah, like I'm telling you guys, like, I just don't know, like coffee's not working anymore. 3 shot, 4 shot, 5 shot. I mean, I'm palpitating, but I'm still sleepy. But someone told me actually that, John, coffee in a lot of amount becomes a depressant instead of a stimulant. And my dumbass didn't even know that. But yeah, so maybe that's the reason why. Maybe I should just stick with 1 espresso shot, but even it's not working. But anyway, so yeah, this is my favorite energy drink, Rise Fuel. And if you ever want to get yourself one, go to Google, type RYSE Fuel Locator, and you can find the nearest one to you. They are in GNC, Vitamin Shop, and every other places. So make sure you have one. Mine, I find them in the Dépanneur next to me. What's a Dépanneur in English? Convenience store. The convenience, sorry, Dépanneur is in French, means it's a convenience store. But yeah, it's just 2 minutes away from my place. Anyways, Bessie, also, if you haven't checked my merch store, you can go to www.nursejohn.com and get yourself some merch. And I'm wearing one of my favorite shirts that I created myself. I'm so proud of me. Yeah. Anyways, the shirt says, woke up and choose to save lives, because that's what we do every single day as healthcare workers, as a mom, as everyone else. We save lives in many different ways. Sometimes you don't even know, right? Everyone is a lifesaver. So thank you for your contribution to society. Anyways, Bestie, so let's head on to this very, very amazing episode, and something that I've been looking forward to. Why? Because this is one of my favorite subject and one of my favorite specialty in nursing. Can you guess what it is? It is psychiatric nursing. You heard that right, Bestie. Psychiatric nursing. And today I have a very special episode who is a nurse, a psychiatric nurse specifically, and we will be talking about mental illness and psychiatric nursing, and we'll debunk every single thing that has to do with the brain, baby. So, introducing the one and only beautiful Elise.
Hello. Thank you so
Hello.
much.
Elise, first of all, thank you for accepting this invitation because you're actually not from Montreal. You're coming from?
From Hamilton, Ontario.
Yes, she is from Ontario. She flew here. I feel so special.
Of course you should, to meet a celebrity.
Oh my God, stop. I literally keep telling people, I was like, guys, I'm not a celebrity. I'm just a freaking clown on the internet. Like,
I think that people should know, like, I am a little bit starstruck because you are internet famous, but John is what you would expect or what you would hope for. He's like a genuinely like really nice, cool person, like off camera too. Like you're such a beautiful soul, and I've only
oh.
known you for 10 minutes like in person, so thank you so much. You really are an amazing person, and you should know that.
Stop. I know. I'm
It's
kidding.
actually so funny naturally. It's not just Instagram.
No, well, thank you so much. I appreciate that because, like I said, like I've been telling people, they're like, "Oh my God, you're such a celebrity. You must be like this and this." I was like, "I'm just like everybody else." I was like, "You'll see me in Walmart. You'll see me in the street, and there's really no difference." Like I said, I'm just a clown on the internet. That's the only difference. Oh my God.
So amazing.
But yeah, so tell us more about you, Elise. Like, who are you? Give us a little background. We want to know you. We want to know more about you.
Yeah, absolutely. So I actually was born and raised in Hamilton. The hospital that I was born in, I also went to the affiliated university. So definitely like,
Oh my God, born and
Very-
raised, baby.
oh yeah,
Is
absolutely.
is Hamilton like a small like ville? What's a ville? Oh my God, I'm speaking
it's not
like
a
bilingual
town, it's
here.
a city. So I actually grew up in Dundas, which is a part of Hamilton. Like this,
Dundas. Isn't Dundas the street in
it is
Toronto?
a Dundas. It is a street in Toronto.
Yeah.
But it's also the town, the name of the town that I grew up in, which is like on the part of Hamilton, like on the outskirts of Hamilton.
Oh, that's amazing. That's
Yeah.
amazing. And
It's a
like I guess
valley.
it's a valley.
Yeah, it's very beautiful. Lots of like nature. The escarpment is really nice. Actually, when I'm staying in Montreal right now, downtown, like the escarpment that's kind of reminded me of like what it's like back home.
Oh,
So it's
really? That's
pretty.
so nice. I
Yeah.
love the suburbs. So would you call it like a suburb area?
It is pretty suburban for sure. Yeah.
Okay, that's cool.
Yeah.
That's amazing. First of all, what brought you into nursing?
Yeah, so I actually studied health studies, gerontology, and psychology before I went on to nursing. So I did in undergrad. Ever since I was little, I just knew I wanted to go into like the business of people, just like
Okay.
interacting with people, helping people. For example, like my mom keeps everything of mine, like when I was little, and like in grade 4 we had to do a project and like, what are your dreams? And mine was literally like, my dream is to be a doctor. So like I've
Aw.
always wanted to be in healthcare in some form of capacity, even when I was very small. So I studied psychology, and it was actually an experience that I had with a nurse when I wasn't feeling well. And he was actually so amazing to me. In university, during my first degree, I was going through like some mental health stuff, as we
Right.
do. It's
Right.
very
As
stressful.
as everyone else does.
Yeah, and he was a nurse like on the university campus, and he inspired me and influenced me just like with his kindness so much. I'm like, I want to be more a part of this. So
Right.
after I graduated from my first degree, I went straight into nursing and did an accelerated degree
Oh my
for my
God.
Bachelor of Science. in
How
nursing.
hard was that then? Because it's a bit of a transition. I mean, like it's kind of in the same field, but at the same time, the requirements to get into nursing is very different compared to psychology.
Yes, it was. From my degree, the electives that I took were very like health sciences,
Mhm.
life sciences based. So I did luckily have like that background that you very much need in nursing.
Oh, that's good.
Yeah.
So health science, yeah.
Yes,
That's a
exactly.
good path. So you were there already.
Yes.
So you kind of focus on the concentrated program in nursing when you get in?
Mhm.
Okay, so I did the same thing because I was in general science before.
Okay.
So I was in tourism because I was like, maybe I could be like a flight attendant or something. But I was like,
I think actually you'd be
right? I was like, what am I going to do with this? Like,
Yeah.
where am I going to fly? So I guess your inspiration is that nurse from your school that really brought you into the nursing profession?
Yes, yeah, absolutely. That experience, and also This is a little bit of an interesting one. Like my sister, who has 3 beautiful boys, when I would be with her on the labor and delivery unit, like after she had her babies, I also watched the nurses and how they would interact with my sister, like being a new mom, and like they were so knowledgeable and like they really ran the show on
Right.
the unit, you know.
Right.
I just like, and I just remember thinking like, wow, these nurses are so interesting and really like, for lack of a better word, like powerful, like with their knowledge and like the way that you
Right.
influence people.
It's very inspiring.
Yeah, and I was like, that's another thing. Just all my experiences with nurses were so inspiring, and
Like,
like
it's
I want to be a part
positive.
of this.
Right,
Yeah,
right.
and I want to touch people's lives the way that these people are.
Right. It's so nice because it's a very opposite of my situation, because my situation, the reason why I wanted to become a nurse is because I hated the doctor who diagnosed my grandpa of stage 4 lung cancer. Now I kind of understand why he said what he said, but when I was younger, when he said, yeah, so spend some time with him because he's dying and that's the only thing you can do. And I'm like, F you. Like, there is always a solution to something.
Right.
And you
right.
cannot just like bring into the family that kind of news that way. Even though someone is dying, you're supposed to still encourage them in a way, kind of uplift them that this may be a bad news, but there are avenues and ways you guys can spend some time with him until the end
Yeah.
without making them feel like, oh, well, this is it for him.
Yeah.
And there's nothing else you can do.
You need to provide hope at any point
Right.
in the life stage. For the
Exactly.
family.
And the funny thing is, they gave my grandpa 6 months to live.
Mhm.
And because of our care and our compassion and our faith, he lived for 3 more years.
Wow.
And I was like, motherfucker. But like, yeah, the doctor was wrong.
Yes.
So I was like, you know what? I'm also going to go in a profession where I can feel like I'm still taking care of my grandpa, because I had this guilt of like, I wasn't able to give that to him because I was so unknowledgeable. Like, I have no idea what's going on. I don't know how to take care of him. When he was choking, when he was having all of these symptoms of cancer, I don't know how to provide care for him. So I was like, you know what? I'm going to go to a profession where I can do that for other families so that they don't feel the way I feel when I was in that situation. And there's only one profession that like was stuck in my head, and it was nursing.
Yeah, absolutely. I can totally identify with that.
So you went to nursing school, and have you been doing psychiatric nursing since then?
Pretty much, yeah.
Oh my God.
I've gone to like a few different places. I started in tertiary care, or like a hospital setting. I was there for a year and a half. I worked on an acute unit. It was concurrent disorders. So it was simultaneously treating mental illness with addiction issues. So what would happen is people would be in psychiatric emergency.
Right.
And once they were a little bit more stable, although often not as stable as we would hope, they would come up to our unit. When I say come up, literally, like they drive them up the hill to the psychiatric hospital, and we would receive these people who were kind of like the end tail of like a crisis, essentially.
Okay.
that
So
they were
like
going
after
through.
like a whole like crisis
Yes.
situation.
Yes. Yeah. And then we would begin treatment. And for some people, that would be a week they would be on the unit. For some people, 4 months, like depending on what's going on. And from our unit, sometimes they would go to a more specialized unit, like specifically for mood disorders or for schizophrenia care, psychogeriatric care, all these different specializations. So ours was kind of like a mixed bag, that acute care unit, just like getting people settled, oriented. And it was a really interesting environment. We had social workers, addiction counselors, psychiatrists, of course, registered nurses, RPNs, registered practical nurses.
So it's almost like
pharmacists.
a whole unit, like
Oh,
a
yeah.
whole running like med surge unit.
Exactly. Nurse practitioners all had their specialization. It was very much like a team setting. Yeah.
And what attracts you to psychiatric nursing? Because again, like there's so many specialty in nursing, and I feel like psychiatric nursing is one of the scariest, but at the same time, it's like, am I really going to be able to do this? Because you might be going through, like you said, some mental illness too. Can I actually take care of someone who is probably, let's say, depressed as me? if I cannot even provide that to myself?
Yes.
That's always my worry.
Yeah. Yes. I'm so happy that you said that, and we're so on the same page about that. And I want to get into that later, how I think mental health is not only an individual problem, it's health. Mental health is a social issue and it's a political issue. And I want to discuss that exactly, and like the trauma that people experience through like their upbringing and like what they've had to go through in society, whether it be poverty, even falling under BIPOC, LGBTQ, all these like
Exactly. Just being an immigrant too.
Yes,
just
absolutely.
like there's so many basic things that you would not even think that contributes to someone's trauma, anxiety, depression. And that's what interests me really to psychiatry of nursing. It's because I was like, okay, well, this is so interesting because you get to know these people and you see them suffer, but then I feel like they could have been a different person if things were just different in the beginning.
Yep, absolutely. Or if we had gotten to them sooner. I was in tertiary care or a hospital setting, but that's one of the reasons why I transferred over to community care, to take more of like a preventative measure, like helping people stay out of hospital essentially for their mental health. But I want to answer your first question. You asked me why specifically did I go into like
psychiatric nursing, yes, mental health.
And what you were saying about your grandpa, and I said I can identify with that. I felt the same about mental illness within my family, friends. So just like all of us, like with our experiences in our lives with mental illness, I also wanted, and even with myself, like my mental health and things that I deal with, my own like personal mental health, I wanted to understand that and be able to deal with it in the best way possible and educate myself and know how to look for signs of like if someone's really struggling, and just wanting to help people, including myself, like just how to live their best lives, like, and have the best like mental health that they can. And this also seemed like the right path to go, like mental health nursing.
For sure, there's going to be like nursing students who's listening to this right now, and they're probably questioning, and they're always asking me, John, where should I go first after graduating as a nurse? And I feel like there's really no answer to that. It's more of like, how do you feel about yourself? Like, what kind of person are you? Yeah. That's what's going to determine what kind of nursing specialty you're going to be doing. If you love moms, then maybe you should be in labor and deliveries. If you love kids, then maybe you should be in pediatrics. If you're more into like mental health, then you can go to mental health. It's really is depending on like what you love and what you find interesting.
Yeah, where your passions lie is essentially is the right way to go for any career, especially in nursing, and that's what's going to keep you in the profession.
Right. And how long have you been a psychiatric nurse?
Going on like 5.5 years.
5.5 years now.
Yeah.
Oh my God. So you actually love this specialty of nursing.
I actually do love it. I live and breathe it for sure in all aspects of my life. It's probably like the hardest thing, and I hate my life a lot. Probably every day I have like a really, really hard conversation with a patient, but at the same time, I can't picture myself doing anything else. Actually, on my flight over here, I had the pleasure of talking to someone, and we got into the conversation of our careers, and he was like, if you could do a start over, just do anything that you wanted, like go back, what would you do? And I was like, I actually think I would still be doing this. Like I would do something in mental health. Like
that's amazing.
I really do love it.
That's amazing. I think we need more like mental health nurses or people advocating for mental health. But you know what? This generation, like the Gen Z generation, are very on top of it. People are recognizing how your mental health takes priority over a lot of things now.
It's so refreshing.
Because again, like before, us millennial people from decades ago see mental health as a taboo or something that it doesn't exist. You're just sad. It's going to go away tomorrow. Yeah. Exactly. But now people are very open about it. They cry on camera. They tell you like what they're going through. And they're very open, like, oh, I have BPD and this is the signs. I love seeing it like on TikTok, on social media, that people are talking about their experiences. I know a lot of people find like social media a bit of cringy in a sense that, oh my God, why are you filming yourself crying in the car? Or like, why are you telling me all of this? Like,
Listen, vulnerability is powerful. It's why people want to keep watching you, because like we need that. And I completely agree.
right.
It is like such a important thing. And you're right. Like, I think for the future of nursing and like how our younger generations aren't afraid to be vulnerable and speak of these real issues rather than viewing it as past generations of nurses do. It is something really beautiful that I think is developing in nursing. And you're right, with like this access we have to like social media, TikTok, Instagram, you can use it for good.
Well, exactly.
You know?
And thank you for that. And like I told you from the very beginning off camera, I was telling you, people have been asking me every single time, like, John, why do you focus so much on the negatives of nursing, on like how shitty it is? You cry in the bathroom. Because I was like, that's the things that you don't see. These are the things that are true to us.
Yes.
That I want people to see, people who have no idea what we go through every single day.
Yeah.
That this is how hard it is. I might be like refilming myself 10, 20 times to make that cry look real.
But
because I want you to feel what shit we just went through so that you understand and so that you don't blame us that your dad haven't gotten his ice chips.
Yeah.
Because I got 67 shit to do and the ice chips is the last thing I want right now.
Yes. Sorry, busy saving lives. Yes, for sure.
Exactly.
Yeah, yeah.
And I was like, you can shed light to positivity by talking about the negative stuff.
Absolutely.
Because already the government, commercials, advertisement shows how like nurses are superhero. They are the people who saves life. Save one life, you're a human. Save 100, you're a nurse. But those are toxic positivity, I think.
Yes.
I think like tell the truth about what we go through as nurses and people will have more compassion, more empathy towards us.
Yes, they'll get it. And that's what's so refreshing about your channel. Like one of your more recent reels on Instagram where you're just like clearly just trying to calm down and you're like pretending to swing like a lasso like this. And you're just like, more passion. I'm just like, and I just screamed with laughter when I saw it. I'm like, he gets it. He gets it. Like that was me 10 minutes ago, like in my office, like by myself, like after an appointment. I'm like, and it actually like brings you back. It like grounds you. It's like, okay, yes, what we actually go through as nurses is sometimes really wild. And like, so,
and that you're not alone experiencing it. That, okay, so I'm not crazy.
Yeah.
I'm not the only mentally ill nurse going through this. And in your career as a psychiatric nurse, have you had any difficult situation that you have to deal with?
Yeah, absolutely. So especially when I worked in the hospital setting for patients that were experiencing psychosis, like they don't really know what they're doing. And it's a really scary place to be when you're not yourself. You're like really, really unwell, and they require like a 4-point restraint, or they require 6 people, like again, like a trigger warning, because it can get really brutal. Like if someone is so unwell and say they're a larger person and they need 6 people to restrain them for them to keep them just safe from like harming themselves. Like I have seen a lot of violence on the unit, and I have seen a lot of people get hurt, especially the nurses, from people who are just so unwell. And of course, it's not their fault, and they don't know that they're doing it. And like that's what I think nurses keep in mind, like when they are getting attacked, which is commonplace, like on acute units like that. And I myself have been like punched before. I've been verbally harassed before.
Right. Doesn't that scare you though to continue in this specialty in nursing? Because again, it's scary and a lot of times it's very traumatizing at the same time.
It is traumatic. And for me personally, when there was this was just like 6 months into me being a nurse, keep in mind too. So I was like new. For me, the incident that happened where I was physically harassed by a patient, I did have trauma from that. And in fact, I had to advocate for myself and receive psychological care.
Oh my God.
I was diagnosed with PTSD because of the experience that I had to go through. And it took a lot of therapy and a lot of self-care to get back to a place where I felt truly safe to be around patients. Yeah.
Wow.
And with the support of my colleagues, with making sure that I took care of my mental health and seeking that psychological care for myself and not brushing it off or feeling bad. At first, I felt weak or like maybe I am not good enough for this profession, like I don't have a thick enough skin to do this. Just doing some more soul searching and like figuring out more about myself through therapy and putting my mental health first for the first time, I would say probably in my life, actually made me into a better nurse, a stronger nurse, more resilient, more empathetic. So actually helping yourself gets you through helping others.
That's true. It's just crazy to hear that you had to go through this extensive therapy just to recover from one incident that just happened.
Mm-hmm.
And not everyone knows how hard that must be.
Yeah.
And the only thing you wanted from the very beginning was to help.
Yeah.
And then here you are, having to go through therapy, which came out very good because you learned how to prioritize yourself, your mental health. But at the same time, did you really have to go through that? Did you really have to have the PTSD for you to help someone? And it's crazy. And I think that's one of the biggest factor that people don't understand. That you screaming at me could literally make me feel like I'm not doing the greatest job. And again, I applaud every single psychiatric nurses. If you're listening to this right now, thank you guys so much for the work that you do. Again, I could never, like I said, I love psychiatric nursing, but I could not imagine going through that. And have you ever encountered a situation with a patient that you're just like, oh my God, we're just like the same? Because so many times when I'm with patients and I'm telling them, oh my God, so you're in Lexapro? Babe, we in it. How are you in a high dosage and I'm this very low?
Oh, yeah.
I know.
When a patient is started on like a medication that I'm on, I'm like, this is a good drug. This is gonna help.
That's going to help, really. But why are you getting more help than I am? Don't you feel like a hypocrite sometimes when you tell your patient like, oh my God, stop smoking, don't drink, this is no good. And then you do it after.
Yes, absolutely.
I have told people so many times, I'm like, oh my God, junk food is so bad for your health. You're like lessening the years of your lives from eating this shitty junk food from McDonald's and stuff. And then my Uber dings. Because security is like, are you ready to pick up your 2 cheeseburger and your poutine? And like, yep, I'm ready. I'm picking it up right now. After telling my patient how shitty fast food is. You know how I call this? This is nurse math. It's bad for you, but it's not bad for me. It's like, do as I say, not as I do.
Exactly.
This is a very personal question, but I want to ask you, what mental illness are you going through at the moment?
So I have been diagnosed with bipolar disorder, type 2. So it is a less severe version.
Can you explain that for people who doesn't know what bipolar type 1 and type 2 is?
Yeah, absolutely. So type 1 is where you go through like a manic phase where they're just like, it's a period of euphoria. You just feel like on top of the world. You feel like you can do anything. It's when people make a lot of risks.
And there's the low, right?
Yeah, and you experience those low
it's depression, right?
Yes,
that's
very
the
much
low.
a depression. It could be the feeling of...
And it goes through cycle.
Yes, very much so. So for me, through therapy and medication, mine is like, I'm happy to say, like just very well managed. And you can lead a really fruitful, like successful life even with mental illness. And
have you had any crisis?
I have, yes. I have been a patient in the past.
In a psychiatric unit?
Yes.
How was that experience for you?
It was not good. It
No.
was not a good experience.
Right.
Yeah.
How would you describe being in a psychiatric unit as a patient and now that you're a nurse?
So I actually was a nurse. It was like the first couple years like of my nursing career.
That you had
That
to be
I ended
admitted
up-
in the psychiatric.
Yes.
So how was that experience for you?
So I think when one of our own, like another nurse, comes onto the unit
Right.
as a patient, it kind of intimidates people or makes people think like, oh my God, like that could be me. Because nurses go through so much and they get it that a lot of the times, some of us, especially during COVID, which is when this happened to me, like sometimes we are one step away from a personal crisis, like with our mental health. And so being on the unit, while I did get a lot of like amazing care from the nursing staff, you could also tell that people seemed like a bit nervous around me too, or would like, what I would assume is because I was also a nurse. I even like recognized people like on the unit, like that was really hard.
Wait, were you admitted on the unit that you were working at?
No, not the one that I was specifically working at, but I had worked at that hospital like in the past.
In the past, so that
Yes.
people recognizes you.
Yeah, that was really, really hard. But also, like, nurses get it and, like, the importance of confidentiality. That's when you really start to understand.
Right.
You're helping out people who you see sometimes in your everyday life, and just, like, protecting that confidentiality could make or break someone. I did feel respected in that sense.
That's good that you feel respected and they respected your privacy.
Take it from me, people who are watching, especially, like, younger nurses, when John is telling you, take care of you, take care of your mental health, take it as someone who didn't do that and wound up in crisis and wound up as a patient. Like, I now, after a lot of self-care and therapy and more wisdom about nursing, I understand that it wasn't necessarily my fault, but there are things that we should do and that you say all the time. Put yourself first, and that will make you a more successful nurse. Like, do tune in to your own mental health and make it a priority. Otherwise, like, I'm living proof, like, you can really fall into like a really dark place.
In my culture, because I'm an immigrant, I came to the Philippines. In our culture, mental health is very taboo. And for me, it took me so long to ask for help, to even go to a therapist, and to recognize that I am not really able to carry this alone by myself, and that I am going to need an external help from someone else to tell me all the things. Because you know how I see it is that what I tell myself is the things that my therapists are going to tell me are the same thing that I tell myself. So why do I have to pay him $700 every week?
Yes. I had that mentality too. Like, I'm a psych nurse. I got this.
Exactly.
Like, I know what to do. No, we don't.
We
Not
absolutely
when it comes to ourselves, because we're too selfless.
Exactly.
And we don't see it happening to us the same way we see it to other people. We think we can just hold it down. And
Exactly. We're so blind
Yes.
with our own struggles and problems, but you're able to do it for others.
Yes.
It's just so hard because I think it's so normalized in our profession that it is okay to work 16 hours. You should be feeling guilty calling in sick because you just want to walk your dog today and you just want to take some time off and breathe. You should help your colleagues and stay for 30-45 minutes so they feel better. No. It's just normalized. It feels like it's part of nursing, and that is something that we should stop doing.
Yes.
Because then it
Yes.
would prevent future nurses thinking that all of this stupid, abnormal things that should not be part of our profession is okay.
Yep.
And again, I am so proud of the Gen Z nurses because they actually stand up for
Calling it
themselves.
out. Yeah.
You're like, oh my God, you've been here for 6 months and you're already leaving? Yeah, because I'm not happy with it.
Yeah.
A lot of you are working like 15, 20 years in the same unit, and you can see how much you hate that unit, but you're just too comfortable and you hate changes, and now you're stuck in there, and now you're affecting other people.
Yes. Nurses are inherently kind, caring, giving people. And if we don't advocate for ourselves, people will take advantage of that
Oh, absolutely.
time and time and time again. So we need this self-advocacy, or we won't continue on, like we won't survive.
Oh,
as
absolutely.
nurses.
Oh my
So
God.
what I
Going
did,
back to the topic that you just talking about, like a lot of mental illness, absolutely, absolutely believe that it's all in childhood. It's how you were raised, the environment that you grew up in, how the people that surrounds you help you grow as a human being. And it's just also another thing about this new generation is we have this gentle parenting, which I love and dear so much, because again, we were all raised by belts and slippers and things like that, and like if you don't get yourself up in there, I'm gonna leave you. But now they're more gentle, like it's okay to feel that way.
Yeah.
And I think that's why this new generation of kids are going to be more kind, are going to be more resilient, are less likely to suffer from mental illnesses, because they are able to recognize what's right and wrong, and they can protect themselves because they're equipped with gentleness.
Yes. At the very least, be able to handle conflict better
Right.
in their lives. And
Exactly.
really learn how to deal with these.
Because a lot of
situations.
us, when we get into a conflict, we go fight or flight. We become very defensive. We become ignorant. We leave the situation. We do things that is not supposed to be done in that situation. But again, that's how you were brought up. And that's what your parents have taught you, that you can just leave a situation and not fix it and let it be that way. Or that you should defend yourself even though you're wrong, because that's the only way you should do it. And I think breaking the cycle is the only way.
Yes.
Like break the cycle, the toxic cycle that keeps repeating itself every single generation.
And how do we do that? We go to therapy.
Yes, baby.
Yes.
I love therapy. I love my therapist so much because,
too.
again, she gives me the most basic stuff that I would, again, tell myself.
Yes.
But if it's coming from someone who's external, it feels more authentic. It feels more like, oh my God, fine, sure. I would take some deep breaths before I react to something.
Oh, hey, that works.
Oh my God, it actually works.
Capitalism can cause disease for sure.
And realizing that you are actually fortunate with a lot of other things in life
Oh, yeah.
can change your life situation.
Something that I do every single morning when I wake up, and I learned this through therapy, is practicing gratitude. I name 5 things in my life that I have that I'm thankful for. And it's so easy to forget about those things, especially in this capitalistic society where they're always like, no, you need more. You're not the best. You're not the most beautiful. You don't have the best cars, the best Botox. It's like,
exactly.
you actually do have so much right now, like in this moment of your life.
That's exactly what I'm talking about.
Yeah.
And I realized how I got deep down into that capitalism and all this like stupid ways of like thinking, and got my mental health worse because when I was living in the Philippines, life was so simple.
Right.
So simple that I don't even think about having the best phone or Botox or making sure my jawline fits like the standards of people, and that my clothes has to be updated on what's brand new and what's aesthetic for people.
Well, it's probably even worse for you because you are constantly bombarded with,
right, but
you need to look this way, John. Like,
right.
You have to be like,
and that's
kind of
honestly something that I have learned through therapy already. And I guess within myself, I realized that I'm not really conforming on other people's opinion. And I have learned that many, many times. I got in so many opinions and negativity for people. But listen, look at my videos. I make myself even uglier as I could because I was like, nurses are not fully freaking caked up when they go to work.
Nope.
This is how we look like. We're messy. It looks like we haven't taken a shower for 4 days. Our mouth stinks. Everything. Again, I want to show the authenticity, the reality of what we really are and how I really am as a person. And it's hard, again, like you said, when you're in social media because you want to be the best. You want to be like everybody else in social media, but you realize that these are all fake. That these are all things that were scripted, that was retaken like
Filters.
20 times to make it perfect.
Yeah.
But at the end of the day, no one's actually perfect.
No.
And even the
Absolutely
most
not.
beautiful person in the world is going through something.
Yes.
Like, I always see this way, that the things that you want from other people, you have the things that they wish they had.
Absolutely.
That's how I see things.
For sure.
That, let's say, oh my God, she has the perfect lips, but she sounds like a fucking duck. But I have a good singing voice. So I might not have the perfect lips, but I have a good singing voice.
Yeah.
You know what I mean? Or, oh my gosh, she has the most beautiful face, but she has an ugly personality, and I might be ugly, but I have a good personality.
Thank God.
And period. And that's all that matters.
Absolutely.
And again, you're blessed with something that somebody else's doesn't have.
Absolutely.
And the thing is, like, you cannot keep wanting to be someone else, because I'm telling you right now, even the most beautiful person in the world wants to be another person.
Yeah. We always want something different than what we don't have. Grass is always greener, for sure.
Exactly.
other
But
side.
you just got to realize that, be happy about who you are, about what you have in life, because again, there are other people that wishes to be in your shoes.
Yes.
Actually, I have a question. Going back to psychiatric nursing, what was the hardest mental illness that you had to deal with?
I would say like working on an addictions unit, that's really hard. People dealing with substance use and mental illness, which I know you so strongly believe like the traumas that we've experienced impact our lives and how we present to the world now.
Right.
That's for me. I'm a strong believer that people who use substances to numb themselves, like the pain that they've been through, what they've had to go through in life, like, and the trauma that they've endured, people who use substances, like, this is where addiction comes from. This addiction is a disease along with other mental illnesses. And for me, that is the hardest to see and the hardest to treat, because it's not only that individual person, like what they're going through, the trials and tribulations that they've been through life. It's a representation, I think, of what's also wrong with our healthcare system, like what's wrong with our society as a whole.
Right.
And this idea, we're such an individualistic society, and we put all the blame on the person rather than looking at health as like a social, political issue. Just looking at our most vulnerable populations, people who have immigrated to Canada, people who identify as LGBTQ+, people who, any sort of reason that makes them a more vulnerable person in society, it labels them as having some sort of weakness. And a lot of times, like, when people turn to substances as like a last resort to kind of like numb that pain that they've experienced like in their lives, it's like you look at someone like, oh, how could they become addicted to drugs? Like, how can they be in alcohol? How could they let their lives get to this point? It's like, it's not all them. It's these issues that we have in society and making people think they are less than.
Right.
And that's, I think, so important to recognize, is like mental illness doesn't exist in a vacuum. It's like we are influenced deeply by how our society is run and what we are told from the beginning, like who we are, like from like an outside perspective. So working with people in addiction and mental illness is really tough work, because we have to look at it as like a whole picture. Like the mental illness that they're experiencing, it's not going to be fixed just with medication. Like,
no.
We have to change things, just like you, how you seek to change like the experiences that nurses are having and like advocating for ourselves. We too have to advocate for our patients who are suffering the most with addiction and mental illness, and realize that it's very much a social issue, not just a medical issue.
Oh, absolutely. It's like, not just treat the person, but treat what's causing the person to be the that
Yes.
way.
Yes.
Because that's the bigger issue. Because you
Yeah.
can treat someone with a medication, but if they still live, if they still are surrounded by the things that makes them the way they are, the medication would not treat that. It's just so hard to think that we really don't have a control on what's going on in the world. The world is so dark. We're so helpless.
Mhm.
And it's hard to say this being in a first world country
Mhm.
where life is supposed to be so much better compared to those who are in a second or third world country. But
Mhm.
sometimes, man, I just feel like people in a third world country are much happier compared to
Mm.
us. But like you said, like I love that thing about nursing, that we look at the person as a whole instead of just like the problem,
Yes.
because that's who we are. Like
Yeah.
we understand that you're going through this. We understand that this is all the problem, but let me help you figure out how we can end all of this sub branches of the real problem.
Yes.
Because it comes from something.
Yeah. Absolutely. That's our greatest strength.
That is
think-
our superpower.
Yes.
And please, I'm not a superhero.
Yeah, a little bit though.
Super mentally ill hero. Well, at least look, it was so interesting to know more about you, your life, you as a psychiatric nurse. I feel like we can talk about this forever because there's just so many things.
We need a
That-
part 2.
We need a part 2. Like there, my God, 3, 4, 5, 6, 7, 8, 9, 10. There's so many to talk about psychiatric nursing, mental health. And it's
Yeah.
something that we need to talk about more.
Mm-hmm.
Because again, it was so taboo before, and I wish we continue with this new generation of nurses and people to keep advocating for it.
Mm-hmm.
That it is okay to not be okay. It is okay to ask for help. You're not weak for having mental illness, and it's totally fine.
Yeah.
And again, hands up for you for what you do
Thank
for
you.
people in our community so that they can function again in our society. And that's really hard. And
Mhm.
again, for someone who is also going through something,
Mhm.
but then be able to forget what you're going through so that you can focus on what someone else is going through
Mhm.
is something so hard to do, but you're able to do it with so much compassion, love, patience, empathy. Like you can just like, okay, I'm depressed right now. I know it's really hard. I'm going through this, but I'm going to push that back a bit so that I can focus on someone else's depression
Yeah.
because this person needs that help more.
Yeah.
And this is what I love to do.
Mhm.
And that's just so hard and amazing because not everyone can do that. Not every single profession can do that, but we do it as nurses. And
That's our talent. That's our
it-
skill.
that's our skill. It comes from the very beginning, like how you were raised, how
Mhm.
things were in your environment. So
Mhm.
I highly, highly, highly suggest for future parents, for parents right now, to be kind to your kids. Show them love, show them respect, show them boundaries, show them how to be able to live in this very dark world
Mhm.
without them resorting from
Yeah.
bad things,
Yes.
things that should never exist.
Yeah. Absolutely.
Oh my God. Well, here we are at the very end of it. Oh my God, you guys, thank you so much for listening to this. And I hope you guys learn a lot about Elise, mental health, psychiatric nursing. And again, we can talk about this for another, 5 episodes because there's just so many things that we can debunk and talk about. But bestie, I will see you all next week. And again, thank you so much, Elise, for coming here and sharing your experiences as a nurse and as a human being. I know that a lot of people have learned from you and from your experiences.
Thank you so much. I'm so grateful to be here. It's
Thank
been an
you.
honor.
It's very nice. Thank you guys so much for listening. Again, if you're listening to this, make sure you download this episode and all other episodes, and make sure you follow and turn on notification on Apple and Spotify podcast. And Bessie, tag me on Instagram whenever you listen to any of the episode. I love you guys so much. Stay caffeinated, medicated, and hydrated. And remember, you are loved. You matter. You are worthy. It's okay not to be okay. And it's okay to ask for help. I love you guys so much, and I will see you again next week. Mwah. Bye.